Hello, I'm Dr. Pierre Samaan. Wonderful to be back with you again today. This is a special broadcast today that we're talking about child anxiety, and I hope this is something that will be helpful for you. I'm director of New Horizons Institute of Counseling. I'm a clinical pastoral counselor, and if you'd like to learn more about me, you can link to a previous video with my credentials, or you can go to our website at www.newhorizonscounseling.org to get all the information you would like to have. Well, we're talking about relationships. We're talking about how to improve your life and relationships from a Christian counseling perspective, more of a spiritual perspective. But it's a perspective that identifies all three main areas of your life: spirit, soul, and body. Of course, we know the soul is the mind, will, intellect, emotions. If you just address one part of that, it's not going to help when there's problems going on, because those problems are just going to keep multiplying. If you address all three areas, then you have a better chance of improving in a speedier way and probably feeling a whole lot more peaceful about it all. Today we are following up with our series on anxiety, and we previously talked about the brain, the limbic system, some of the breakdowns in the brain area of what produces anxiety, what is the fear and emotional centers of the brain. And you can look at our previous video to be able to see that in more detail and pick up more information regarding the dynamics going on there. In child anxiety, it's such a sensitive area because these are our children. And we feel so powerless as parents. My wife and I, Linda and I, we have two sons. They're adults now, of course, and they have families of their own. And our little grandchildren, when they're sick, it's devastating. You feel so powerless, just as we did as parents with our boys. But when anxiety comes in the mix, makes it even more difficult for parents because, gosh, you can't see it other than the behavior that occurs. And if they're really young, they can't really explain it. And so it's a matter of, I feel powerless. What do I do about this? So we're going to talk a little bit about all that and helping you to understand some more about it. Not so much from a clinical perspective, because you can look up anywhere about anxiety and get all those clinical words and everything, but from a perhaps more personal experience. Previously, I spoke about Linda and her experiences with her anxiety, panic attacks, and agoraphobia. And you can go to the previous video to watch that if you like. It's given me a great deal of experience in treating those with anxiety in my faith-based counseling ministry. So when we're dealing with anxiety in children, it's important to know, and I guess there's three questions that people often ask. What does it look like? What am I seeing here? And where did it come from? As parents, we tend to want to blame ourselves for anything that goes wrong with our kids, but it's not always the parent's fault. And sometimes we wonder, well, how can we avoid this for the next child coming along? We don't want it to happen again. And I want to just emphasize, it's not the end of the world. It's just anxiety, and all anxiety is treatable. So that question, where did it come from, is often asked. And the third question that's often asked is, what can we do about it? Okay, I know all I want to know. How do we fix it? We want to fix things as quickly as possible. And it's important to fix something like this as soon as you possibly can. Well, anxiety can involve, with children, a number of areas. There can be just plain anxiety, there can be separation anxiety, or a social phobia of some sort, a specific phobia. And we'll be getting into some more specifics on all that in the next segment that we're going to do on anxiety, which is going to be teen and adult anxiety. But when we're talking about children, no matter what type of anxiety a child may have, it's fixable if we address it. And the earlier we can address it, the better. If we wait too long, too many things pile up. It creates self-esteem problems in the child. It makes them feel like they're different, and at school the problems can occur. And when that happens, now they're being singled out and perhaps picked on and so on, and it just intensifies their view of themselves as being handicapped in some way. We're all handicapped in some way. We all have our weaknesses of some sorts. It's learning how to capitalize, how to use those weaknesses that we have and turn them into something good. And that's how God created us. He created us with both strengths and weaknesses. And they balance. If I have a strength of being assertive and knowing what I'm saying to be true, performance-based, but I don't have a weakness to balance that with, I'm going to become arrogant, prideful, and probably nasty and all that other stuff. So the weaknesses are there to balance us. So weakness brings down those strengths to a place that's reasonable, a place that's it is intended to be. So when there's anxiety, it doesn't mean it's a terrible, awful thing, but it means let's control it and not let it control us. And so with our children, we want to be able to help them to not let it control them, but help them to learn how to balance that with all the rest of the good parts of themselves. Anxiety disorders in children affect 1 out of 8. That's a lot. Now that figure was taken a while ago, and the new census, it's going to come up, I'm sure. And it doesn't mean it's the water they drink or it's the food they eat. It's usually a combination of a lot of things. And we're going to look into some of those things. So some of the anxiety symptoms that we see in children are the obvious symptoms, and we see them in adults as well. Persistent worry. Now we all worry, but with anxiety, it's persistent, it's chronic, it's over any little thing there's a worry, and what tags along with the worry is fear. We spoke earlier in a previous video about how there's a difference between anxiety and fear. In anxiety, you're not really knowing why you're feeling what you're feeling. You may have some ideas. Fear, it's obvious. You're walking across a 4-lane highway, the fear is these trucks, these cars are going fast, I hope I make it across safely. Anxiety is you're standing there and there's no traffic, and yet you're feeling fear, you're feeling apprehension, you're overly worried, overly concerned, in fact so much so that the day before you were even worried about what you were going to do the next day because you were going to have to cross that street. That's anxiety. Well, constant talking about or when someone talks too much. That could be in their personality or their temperament. Sanguine temperaments, those are extroverts of high intensity. They like to talk, and so they're always talking. Cholerics, they like to talk, they like to debate, they're often talking. Phlegmatics, they can be talkers or not. So temperaments play into all that. But when there's anxiety involved, it goes beyond what would be normal for that temperament or that individual. And then on the other hand, the opposite can occur. They don't talk at all when they get anxious. They shut down or withdraw. Overactivity often occurs with children. You may not see that with adults, especially with depression. Oftentimes depression, adults are going to be withdrawn and so on. Children, on the other hand, don't know what they're feeling, and so the motor starts running. And they're uncomfortable, so to stop feeling uncomfortable, off they go, and they become overly active. Sometimes it gets misdiagnosed as ADHD, attention deficit hyperactivity disorder, which is why it's important to get a good diagnosis from a child psychiatrist is usually what I always recommend, and let him give you the impressions that he has regarding all that. And when there's anxiety, a child tends to lose focus. They have trouble concentrating. Adults say it's the same way. You're preoccupied with feeling the discomfort, and you're focusing on that. Maybe your heart's beating, or your blood's rushing, or you feel a little dizzy, or any number of symptoms may be coming up. You're thinking about those things, and you're not sure, why am I feeling this way? Because a child, he or she doesn't have the brains yet. Their brain hasn't grown enough to be able to understand, especially if they're under 9, 10 years old. There's a part of the brain that hasn't formed yet to help them to put pieces together, to help them to think in an abstract way. 2 + 2 = 4. Well, they memorized that before, but they didn't really understand it. At 9 or 10, that new part of the brain forms that helps them to understand that. And so then they're able to get into more complicated math, which I'm sure they all enjoy. But with anxiety, they enjoy it all the less because they have to focus a little more, concentrate a little more. And it's easy to just quickly give up and get angry. And oftentimes you'll see that with children, and they feel insecure with anxiety. That means they need your constant reassurance. It's frustrating as a parent. Sometimes you just want to say, stop it, like grow up. But that's not the answer. That reassurance is important. And it is like an empty well. If there's anxiety, you're constantly having to fill it with reassurance. And yet there is a limit. There is a fine line as to going too far or not. And that's why not doing this alone can be very helpful. Seek out help from those who have experienced it, other parents who perhaps have a child that's had anxiety, teachers, counselors, your doctor. Talk about it. Don't be afraid to talk about it. Physical symptoms can include, for children, headaches oftentimes. I get a headache. They may not have a headache, but it feels like a headache. A stomach ache. I don't feel good. Or they may throw up. They may have diarrhea. Stomach ache, headache, oftentimes is a result of that 10th cranial nerve that starts in the limbic system, the emotional fear center of the brain, where the amygdala and that fight or flight response is located. And when that 10th cranial nerve, venous nerve, gets agitated, it inflames, when it inflames, everything it connects to gets spiked up somewhat. And when that happens, stomach aches or headaches or breathing, because that venous nerve passes through the ear, the back of your tongue, the throat, the heart, the lungs, the stomach, the abdominal area. There's also oftentimes with children, they might not want to eat because they're feeling anxious. And again, that's that nerve that's causing the stomach to tighten up, perhaps causing excess bile to be secreted to digest what's in there, because that's part of the fight or flight response. You digest that food there because you need all the energy to go out to the muscles and everything. There's a higher risk of poor school performance. When children are involved, they may start off well in the calendar year for school, but suddenly there's a sudden drop-off in their performance. And your teacher says something, and you helping them with their homework or whatever, but you can't quite understand it, and they're getting irritated with you for making them focus and concentrate when the anxiousness is inside them that they can't explain to you why or what they're feeling. And so a lot of times school performance drops suddenly. Certainly that's a sign of other things too, but we're talking about anxiety in children today, and so that's one of the signs to look for. But also what happens is they miss important activities. Birthday parties, school activities that are extracurricular activities, networking with their peers in school by participating in, let's say, the choir or the theater in a play that they're going to do. With that anxiety, oh boy, that makes it very difficult for them, and the tendency is to take the path of least resistance. No, I don't want to go. And if they scream and holler enough, the parent says, okay. And what also often occurs is depression. And as I mentioned earlier, sometimes depression is what you commonly see: withdrawing, sadness, staying in bed or whatever. But other times, especially for children, that there's overactivity going on to forestall the feelings of depression. And so they play more, they do more, they're crawling up the walls and so on. And as I said, it could be misdiagnosed as ADHD or something else. And certainly the factor about eating can cause eating disorders to start early, and we don't want to feed into that. There's basically, for children, the way I see it, there's around 4 reasons that we might see anxiety. And it's that overactive trigger that causes the fight or flight response to occur in the brain, as we talked about in previous video on the subject. But the first thing that we often ask for is a history of the family. Has this been seen before? Is there a parent, grandparent, aunt or uncle, or someone in the family that has experienced anxiety or some type of disorder that could be linked to the anxiety? So genetics. Genetics is one of the things that we look at. A child who has a family member with anxiety, certainly there is a possibility, there's no guarantee, but there's a possibility that that gene could have been handed down. Kids inherit those genes, and good and bad genes. And sometimes they skip generations, sometimes more inclined towards a daughter or a son may receive that gene depending on the problem, but genetics is important. The second thing that we look at that's important is brain chemistry. We can't see it unless we send the child to a psychiatrist, neuropsychiatrist, child psychiatrist who does scans of the brain. I often refer my clients to the Amen clinics here in the Atlanta area because Dr. Daniel Amen does a lot of great work with SPECT scans of the brain, and I've followed that for many years. And he can look at those scans and recognize what the problem is and how to treat it fairly quickly. And that also helps us as parents to be able to say we can focus and we can see where the problem is. And they're learning even more things as the technology gets better. So brain chemistry, the chemicals in the brain. Sometimes it has nothing to do with anything going on around the child, and perhaps nothing to do with the inheritance of the DNA. It could be just something that happened to that child in birthing or in some other area of their young life that just kind of triggered a change in chemistry. The third thing we look at is life situations. Life situations is obvious. We might say environmental situations. What's going on? Those things that happen in a child's life can be stressful, and it can be very difficult for them to cope with. We may be coping fine because we're adults. And oftentimes I used to have to say, when my boys were young, I used to have to remind myself, they're only 6 years old. They're only 7 years old. Don't expect them to think like I think or to be an adult. It's okay because they're young. Loss of health, loss of a loved one, aggravation or fear. Just a parent yelling at the other parent because they've had a bad day and suddenly they get triggered of some sort, and certainly they shouldn't be yelling, but they yell. Well, it didn't seem that loud. Or they raise their voice. Well, it didn't seem that loud. But to the child, a little child can even they can start shaking when they recognize that an adult is angry or upset. Even babies. We often see mothers who are in high stress situations, and the baby can sense it. They feel that stress. They feel that tension coming out of the mother when the mother's holding that child, or even when they're in the presence of the mother. So it can start early. Learned behaviors, growing up in situations that are scary, difficult, unpredictable. Oftentimes we see in the world where there are countries that are in war, have been in war for many years, a great deal of anxiety problems, depression with that group, that culture, because it started young. And when that happens, other disorders spawn off from that. They spin off from that. Bipolar disorder is often seen in areas of the world where there's a great deal of stress. And we don't want that to happen to our children, so let's work on reducing that stress in the home if there is stress in the home. There was a paper that came out in 2018. It was called Mother-Child Bond and Mitigating Toxic Stress. And they've done research on it before, but this is a more current research that was done, and I'm quoting from that research. Research now shows that anxiety, depression, or intimate partner violence experienced by women while pregnant, in addition to traumatic events experienced during childhood, may adversely impact the development of children, unquote. Well, there you have it. The researchers are now saying that things like anxiety can start in the utero. They can start at that moment of conception, at that time in which the fetus is so vulnerable because it's so dependent on the mother, feeding it in various ways. And when that happens, brain development can be damaged, because typically when the mother experiences stress during pregnancy, those stress hormones get secreted from the fight or flight center of the brain. Once in a while it's okay, but often it's not okay. The glucocorticoids, the adrenaline, other hormones, stress hormones get secreted, and they've learned recently that the placenta that protects the child keeps many toxins away. But in that case, those hormones, those stress hormones, if it's enough, pass through the placenta and get fed into the growing fetus, the growing child. And when it gets fed in there, it affects the brain mainly of that child. So the child's brain is, in some cases, if it's severe enough, will be impaired in the limbic system and perhaps other areas. As we've spoken about before, that limbic system is the fear, emotional center of the brain. That's where the anxiety comes out of oftentimes, and that fight or flight response. It causes inflammation to those growing tissues, to those growing neurons, to those growing cells. That inflammation impairs the amygdala, the fight or flight portion of the brain. It impairs it in such a way that it has trouble calming down, and that creates a difficulty for the amygdala to cycle down when it gets excited. And so there's an alarm system that is going awry early on. And again, mom, don't take it personal. You don't want your child to be harmed by anything you say or do or don't do during pregnancy. You want your child to be perfect. Sometimes things are out of your control, and it's a matter of getting the help that you need as soon as you can. Don't stay in a violent relationship. Don't stay in a situation that's causing you so much stress that those stress hormones are flooding your system and possibly impairing some of the health of your future child, your growing child. There's a threshold for anxiety, and if we pass that threshold, then it just comes more often than it ought to. There's 3 measures of stress that we look at, and you can look up stress, read all about it. We don't have time to get into details about stress. Perhaps in another program we will, but in this case of recognizing that stress, to be able to do something about it as soon as you can, There's overt physical stress, or sexual abuse. There's neglect. There's socioeconomic deprivation. All can lead to enduring emotional problems, immune system problems, metabolic blood flow, energy flow, difficulties, and it can also spin off into diseases as the immune system is reduced because of stress. If you identify those things and you're pregnant, do something about it. You can get as much help as you possibly can. Talk to people, call a friend when you're feeling overwhelmed. Talk to them on the phone. You don't even have to say exactly what's going on, but just talking to somebody helps calm you down. Children raised in high stress, low nurturing, or abusive environments will have that overdevelopment or inflammation of the limbic system, parts of the limbic system, if not all the parts of the limbic system. And when that occurs, there can be underdevelopment or there can be overdevelopment in that region of the brain, but then in the other regions of the brain as well. There can be difficulties with reasoning, with love. Your judgment can be off. There's higher levels of stress hormones throughout development, and that doesn't mean they're bad, but you don't want them constantly occurring. When that lowered immune system happens because those stress hormones are coming more often than they should, chronic diseases, depression, anxiety, inflammatory diseases, the metabolic problems that we spoke of will occur. It's one or more of them. And there's also a difficulty with empathy, understanding, putting yourself in the other person's shoes, recognizing they have needs too, because anxiety brings about self-protection, and self-protection brings about selfishness, and selfishness brings about self-centered, I'm more important, or my need right now is more important. Very hard to see the need of somebody else. And so these high stress things create difficulties in compassion, trust, altruistic love. That's giving of yourself, giving freely to others, sympathizing, patience. Gosh, it's hard to be patient when there's anxiety or those stress hormones are kicking in. What do we do about it for children? How do they get treatment for all that? Well, there's different treatment models, and you never really look at one model and say, that's the formula, that's the one I'll use all the time. They all have good parts to them, and they all have something that may be not so good. So you read about those models that you feel are right for your child, and then see a child psychiatrist. As I said earlier, I prefer sending them first to the child psychiatrist so you can get a complete evaluation that covers all the medical factors of that child. So we're not just focusing on the obvious, because a lot of times there's the not so obvious that the medical doctor can identify. And if you can't afford a child psychiatrist, go to your family doctor, your primary care physician. The most common model that's used is cognitive behavioral therapy, where they help gently face those fears. In Christian counseling, we use a biblical model, which from my opinion, cognitive behavioral therapy came out of that big biblical model. In fact, Freud, in his theory, he developed his theories from the work of a Christian psychiatrist 100 years before Freud, who got it right out of the Bible. So cognitive behavioral therapy works very well. Biblical counseling, biblical model. We don't counsel them biblically. We counsel them in right or wrong thinking, which is cognitive behavioral therapy. Those things are important. I hope this was helpful for you today. Look up for more information regarding anxiety in children. Call me if you have questions or email me. I'll be happy to respond. And I pray that your family will thrive and that no matter what's going on, God will always help you to take the weaknesses and turn them into strengths. We all have that genius part in our brain. Let's find it and capitalize on it. God bless.